Hi, I'm Jason Rogers, the Delaware County Emergency Management Director. Today is Friday, March 27th, and we're here again in the EOC. And today I have with me TJ Sanders, Delaware County Advanced Emergency Medical Technician. Thanks for joining us today, TJ. And I also have Lieutenant Kyle Thomas, who is a paramedic for Delaware County EMS. Welcome, guys. TJ, I'm going to ask you the first question. When you get dispatched to a call that you think might be COVID-19 related, can you kind of take me through what information you get from the dispatcher, so you know what you're getting yourself into or how you're preparing to arrive on that call?
It really just depends on what information dispatch is getting from the call person. If they're getting good information and they can ask the appropriate questions, and we can respond accordingly.
So what is that information that the dispatchers are asking?
What kind of symptoms the patient may or may not be having, if they've been around anyone sick, if they've been out of the country or traveled extensively recently or anything like that.
Lieutenant Thomas, this question is for you. Can you go through the patient questioning process? When you arrive on a scene, what do you ask an individual with like flu-like symptoms?
So every call we go on, if they meet the criteria through dispatch, and dispatch lets us know, when we arrive on scene and make contact, we've all got cards that have the most common symptoms for COVID-19 on it. Generally, some of the first things we ask people are what they've been experiencing. Have they had a cough, any shortness of breath, nausea, vomiting, body aches, weakness? If they meet those criteria, obviously it's in the field to be presumed that they may be positive for coronavirus, and those are things we go through. And if they answer to those and they meet the criteria, then we go through, and we've got a list of phone numbers on here for the most common hospitals in our area. So we have IU Ball, St. Vincent Anderson, and Community Anderson, which are the three hospitals we transport patients to. We have the phone numbers for the charge nurses, so we can call them and we can let them know what's going on. So before we ever leave the scene, we can find out where they want us to take the patient and what they want us to do with them.
And that's all done through the questioning. Can you give us the questions that you ask on the card?
Yeah, so for everyone that we may suspect has any sort of COVID-related symptoms from the get-go, the first thing we'd ask is, have you had any close contact with a laboratory-confirmed COVID-19 patient within 14 days of symptom onset or had contact with a person who has? Have you traveled outside of the state of Indiana within 14 days of getting sick or had contact with a person who has? And have you had any new respiratory problems, fever, chills, or persistent cough? If yes, how long have you had these symptoms? And if they answer yes to any of these, is when we turn the card over and we go through the contacts.
So those cards came maybe a week ago, and we obviously have seen a lot of cases here in Indiana, more so than we had a week ago. So the travel question, does it mean a lot now, or are you more focusing in on have they been around anybody that's been sick?
Yeah, the travel question doesn't really mean anything now. I mean, we've had several hundred cases here in the state, so there's local spread. So the fact is whether or not someone's traveled outside the state doesn't really mean anything. We concern ourselves more with if they've been around anyone who's sick or if they maybe work in a setting where they may be exposed to it.
Okay, thanks. Can you take us through the process of how you decon or decontaminate the back of the ambulance for your patients in between calls?
Yeah, so we have a disinfectant spray that we really just spray on any surface that the patient touches when they're in the patient compartment, or even the things that we've touched after touching the patient. We make sure everything gets sprayed down. With that certain disinfectant, we spray it on until it dries to make sure that any sort of pathogen on there has been taken care of.
So you wet it down and then let it sit for an amount of time, and then it air dries?
Yes.
Okay. And how much time does that take you in between calls to get that truck ready to go for the next call?
Anywhere between, I would say, 2 to 5 minutes, depending on the level of decon we need to do.
This next question is for Lieutenant Thomas. What are the symptoms that you're seeing on the street? What do these patients look like that you're seeing you're dispatched to flu-like symptoms? What is it that you are being able to key in on right away when you see potential cases that are suspected coronavirus, COVID-19 suspect patients?
So most of the people that we've seen have just as soon as we walk in the door, usually the first thing you notice is they look ill. They just have a general ill appearance to them. Most of them have been pale. They've been diaphoretic. And then everyone that I have personally seen has been complaining of chills. They've all complained of body aches, generalized weakness. And then the big one that really moves you away from the flu is almost all of them have also said that they've had a onset of shortness of breath, that day is what's led them to call. And they've also had a persistent cough, have been the big ones we've seen. A few of them have had fevers and several haven't.
How long, what is the onset like?
Most people that I've actually dealt with have said that they've started experiencing some sort of symptoms within the last 4 to 5 days. And generally it's gotten progressively worse, with shortness of breath being the last thing they experience and the one that concerns them enough to call 911.
Well, I want to thank these guys for taking just a few minutes out of their day to join us. And you can kind of see the things that we're seeing out in the public safety community. So that is the information that we can pass along today. So remember that using the virtual medical appointment through the COVID-19 hub, you can visit a healthcare provider and have a screening done at home before you would go to the hospital or your doctor. So make sure that you're using that, and certainly if the symptoms get bad enough, call 911 and somebody will be out to help you. So from the Emergency Operations Center, I'm Jason Rogers. Thank you for joining us today.